Copyright 2018. Wolters Kluwer. Chapter 15. Nursing care of a family. During labor and birth. Theories explaining onset of labor. The uterine muscle stretches from the increasing size of the fetus, which results in release of prostaglandins. The fetus presses on the cervix, which stimulates the release of oxytocin from the posterior pituitary. Oxytocin stimulation works together with prostaglandins to initiate contractions. Changes in the ratio of estrogen to progesterone occurs, increasing estrogen in relation to progesterone, which is interpreted as progesterone withdrawal. The placenta reaches a set age, which triggers contractions. Rising fetal cortisol levels reduce progesterone formation and increase prostaglandin formation. The fetal membrane begins to produce prostaglandins, which stimulate contractions. Components of labor: passage, woman's pelvis. Passenger, fetus. Powers, uterine factors. Psyche, psychological outlook. Passage. Route from uterus to external perineum. Passage. Route from uterus to external perineum, pelvic inlet and outlet. Components of labor: passenger. Structure of fetal skull. Diameters of fetal skull. Molding. Fetal presentation and position. Attitude. Fetal lie. Engagement. Station. Fetal attitude. Station. Types of fetal presentation: cephalic, breech, shoulder. Position. Relation of presenting part to specific quadrant of woman's pelvis. Right anterior, left anterior, right posterior, left posterior. Fetal position. Mechanisms, cardinal movements, of labor. Descent. Flexion. Internal rotation. Extension. External rotation. Expulsion. Cardinal positions of the fetus. Powers of labor. Uterine contractions. Origins. Phases. Contour changes. Cervical changes. Effacement. Dilatation. Effacement and dilation of the cervix. Psyche of labor. Women who manage best in labor typically have a strong sense of self-esteem and a meaningful support person with them. Women without adequate support can have a labor experience so frightening and stressful that they develop symptoms of a post-traumatic stress disorder. Signs of labor, preliminary signs of labor. Lightening. Increase in level of activity. Braxton Hicks contractions. Ripening of cervix. Differentiating between true and false labor contractions. Signs of true labor. Uterine contractions. Rupture of membranes. First stage. Latent phase. Active phase. Transition phase. Second stage. Period from full dilatation and cervical effacement to crowning and birth of infant. Third stage. Placental separation. Placental expulsion. 2020 National Health Goals related to labor and birth: reduce the rate of maternal deaths to no more than 11.4 out of 100,000 live births from a baseline of 12.7 out of 100,000 live births. Reduce maternal illness due to pregnancy complications developed during hospitalized labor and delivery from a baseline of 31.1% to a target level of 28%. Reduce cesarean births among low-risk, full-term, singleton, vertex presentation, women from a baseline of 26.5% to a target of 23.9%. 2020 National Health Goals related to labor and birth: reduce the rate of fetal deaths at 20 or more weeks gestation to no more than 5.6 out of 1,000 live births, from a baseline of 6.2 out of 1,000. Reduce the rate of fetal and infant deaths during the perinatal period, 28 weeks gestation to 7 days after birth, to no more than 5.9 out of 1,000 live births, from a baseline of 6.6 out of 1,000 live births. Assessing maternal and fetal responses to labor, maternal responses. Physiologic effects of labor. Cardiovascular system. Cardiac output. Blood pressure. Hemopoietic system. Respiratory system. Physiologic effects of labor, cont. Temperature regulation. Fluid balance. Urinary system. Musculoskeletal system. Gastrointestinal system. Neurologic and sensory responses. Psychological responses to labor. Cultural influences. Response to pain, fatigue, fear. Fetal responses. Neurologic system. Cardiovascular system. Integumentary system. Musculoskeletal system. Respiratory system. Assessing danger signs of labor, maternal. Blood pressure. Abnormal pulse. Inadequate or prolonged contractions. Abnormal lower abdominal contour. Apprehension. Fetal. Heart rate. Meconium staining. Hyperactivity. Low oxygen saturation. Maternal exam. History. Physical exam. Leopold maneuvers. Rupture of membranes. Vaginal exam. Sonography. Pelvic adequacy. Maternal exam. Vital signs. Laboratory analysis. Blood. Urine. Uterine contractions. Length. Intensity. Frequency. Fetal exam. External and internal electronic monitoring. Telemetry. FHR and uterine contractions. FHR patterns. Baseline FHR. Variability. Periodic changes. Locating heart sounds by fetal position. Fetal exam. Scalp stimulation. Fetal blood sampling. Acoustic stimulation. Nursing diagnoses, labor and birth, pain related to labor contractions. Anxiety related to process of labor and birth. Health-seeking behaviors related to management of discomfort of labor. Situational low self-esteem related to inability to use planned childbirth method. Outcomes, labor and birth, patient states pain during labor was tolerable because of her advanced preparation. Patient verbalizes her need for non-pharmacologic comfort measures was met. Patient and family members state the labor and birth experience was a positive growth experience for them, both individually and as a family. Nursing care during labor and birth, first stage of labor. Respect contraction time. Change positions. Voiding and bladder care. Support. Pain management. Amniotomy. Second stage of labor. Preparing for birth. Positioning for birth. Pushing. Perineal cleaning. Episiotomy. Birth. Cutting and clamping cord. Third and fourth stages of labor. Oxytocin. Placental delivery. Perineal repair. Assessment. Immediate postpartum. Question: a patient you care for in labor asks you what causes labor to begin. Which of the following statements is a possible explanation? Progesterone levels rise at term to initiate contractions. The ovary releases additional estrogen at term. Prostaglandins may be the causative factor of labor. Calcium is drawn from bones to block relaxation fibers. Answer C. Prostaglandins may be the causative factor of labor. Rationale: the cause of labor is unknown, but prostaglandin release is one of the possible causes. Question: If a fetus is in an ROA position during labor, how would the nurse understand the fetus to be positioned? In a longitudinal lie facing the left posterior. Facing the right anterior abdominal quadrant. In a common breech delivery position. Presenting with the face as the presenting part. Answer, A. In a longitudinal lie facing the left posterior. Rationale, ROA, right occiput anterior, means the occiput of the fetal head points toward the mother's right anterior pelvis, the head is the presenting part. Question, which would be appropriate teaching about the force that propels the fetus through the vagina during labor? It is a combination of fundal and abdominal pressure. It is mainly gravitational from the superior fetal lie. It is cervical contractions beginning with full dilation. It is abdominal and perineal muscle contractions. Answer, A. It is a combination of fundal and abdominal pressure. Rationale, bearing down using abdominal muscles plus fundal contractions provide the power that moves the fetus forward. Question, although the time frame for labor differs with individual women, which time period would you find excessive for a nullipara woman? A latent phase of labor of 24 hours. A deceleration phase of 2 hours. A phase of maximum slope of 1.5 centimeters per hour. A fetal descent slope of 1 centimeter per hour. Answer A. A latent phase of labor of 24 hours. Rationale, a latent phase typically does not last more than 6 hours in a woman having her first child.